Stephen Eidelman, for over 35 years, has made the welfare of the disabled his life's work. He has led change in a variety of settings for people who are mentally challenged and have other developmental and physical disabilities. In 1974, he was a graduate student at Social Work Administration at the University of Maryland in Baltimore. He accepted a year-long field placement at the John F. Kennedy Institute for Handicapped Children, the first university-affiliated facility. That experience really changed his life. 1 year turned out to be 5 years. And under the watchful eye of many excellent faculties in 24 professional disciplines, he became hooked on the field of services and supports to people with developmental disabilities and to their families. Steve has held many positions both in the public and the private sectors, including the executive director of the ARC and the Joseph P. Kennedy Foundation. He is also an advisor to Special Olympics. Beginning in September 2005, Steve became a professor in the College of Human Services, Education, and Public Policy at the University of Delaware. Currently, he is the H. Rodney Sharp Professor of Human Service Policy and Leadership at the University of Delaware. During breaks in his academic year, over summer vacations, and while on sabbaticals, Steve travels the world at the invitation of governments and organizations bringing the message of inclusion to those working towards deinstitutionalization of the disabled citizens. Steve and his wife, Rachel, live in Maryland. They have 2 children, Jenny, who's an attorney in a District of Columbia, and David, an educator at the Audubon Zoo in New Orleans. We are very pleased that he is able to be with us today. So please join me in welcoming Steve Eidelman.
So what are the biggest disabilities? I mean, shout it out, take a guess. Yeah, autism, what else? Yeah, well, loneliness is the biggest disability. And this is a conference about recreation and people with disabilities. Isolation is one of the biggest disabilities. Boredom is one of the biggest disabilities. And people's attitudes towards people with disabilities are themselves a disabling condition. Sort of a pop psychologist, Leo Buscaglia, sort of said, you know, we need others to love and to be loved by them. There's no doubt without it. We, like the infant left alone, would cease to grow, cease to develop, choose madness, and even death. Well, we can't regulate it, but we can address it. We can train against it. We can develop programs to keep people from being lonely. And then we always get the question, well, what's normal? And the only thing I've ever figured out in 35 years of work is that normal's a setting on the dryer, okay? I don't think there's any other good definition for normal. I don't have a lot of graphics usually because people with autism have told me graphics really, and things that move around a lot, don't help them, so I don't do graphics. So I spent about a year sort of traveling the world with a group called Inclusion International, and in Okinawa came up with this saying from the report. The reason for which you wake up in the morning, that's what your adult life is about. And for many people, recreation is a reason to get out of bed. It's a reason to do something, and everybody needs a reason. I don't care how significant your disability is, I don't care how old you are, how young you are, you need a reason to get out of bed in the morning. So what's inclusion? Lots of definitions. I'm an academic, I could go on for on and on and on, but it's in part equal access, because you got to have access to be included. It's about participating, really participating. Sometimes it means we modify and adapt things. One of the big principles in the Americans with Disabilities Act was reasonable accommodation. How do you adapt things to work for people? All right? And then giving everybody an opportunity. What it's not is a separate program in the same building. Physical presence alone isn't inclusion. It's not programs only for people with disabilities, though I do a lot of work with Special Olympics, and I just came back from Korea where they had their World Winter Games, and I saw incredible things from camaraderie to people, what's that thing called, a snowboarding, going down a slope that I'd be afraid to even climb. So there are lots of reasons people aren't included. The research is fairly clear, but the biggest one is attitudes. Part of it is access, both physical access and transportation, the ability to get there. Part of it's money, and part of it's training of staff, because if we train people well enough, they can figure this stuff out. There are sort of 3 levels that people can be included. One's physical, getting in and out of the facility. This facility, I think, is pretty easy to get in and out of. It seems to be ramped in the front. The bathroom seems to be accessible. My sleeping room was accessible. Functional isolation, you've got to have some degree of success once you get there, not just be there and sit over in the corner. And I've seen that more times than I can count. And then social inclusion. And for young people, my sort of measure of social inclusion is after your recreation event, after your social event, you go out for pizza. If you get invited out for pizza, you're included. If you don't. So there's lots of rights to be included that are in law. And these are just some in America. We've got probably one of the strongest set of laws in the country. So education for kids, in government programs getting federal money, architectural barriers, and then the ADA. The United Nations Convention on the Rights of People with Disabilities, 130 countries have now ratified it. Sadly, we did not. The US, it failed to get ratified in the last session of the Senate. We'll see what happens. But it talks a lot about the right to be included in all aspects of your country's life and programs. So it takes access, it takes the built environment, takes participation in terms of how things are executed, how you modify and adapt programs. And those of you who work in programs do this stuff, it's like mother's milk. And then adherence, can you sustain something both for the person and the program? Program's no good if you can do it once and can't afford to do it again, or if a person comes once, participates, enjoys it, but never can come back for multiple reasons. There's a website, if you don't know it, sort of in every field there's a mecca, all right? And the mecca in recreation for people with disabilities is the National Center for Physical Activity and Disabilities. It's run by a guy named Jim Rimmer. It was at the University of Illinois. They moved it to the University of Alabama in Birmingham for reasons unknown, except they gave him a lot of money. So it's more than allowing people to participate. It's got to be a value. Inclusion first and foremost is a value. You've got to say every single person has value. Every single person has something that they bring to the table. And again, we know that if we do the right kind of training and support, we can figure all this out. There was a discussion in the Senate about a week ago about the president's budget and where money's going to go. And Senator Warner from Virginia, Mark Warner, and he was one of the guys who founded Nextel. So he was a very successful businessman before he went into politics. He was governor of Virginia. And he said any business worth its salt spends 5% of its budget on training its people. Now, I think if we surveyed the organizations here, if we got up to 1%, it'd be a lot. That's been my experience with both public and private human service and recreation and leisure organizations. Maybe it's a little higher in yours, but to make inclusion successful, you have to invest, and Senator Warner's benchmark was 5%. And it's not only compliance. As I said, we've got all those strong laws and regulations, but compliance is different than commitment. It's different than commitment. You comply with something because you have to. When you're committed, you do it because you want to. You think it's important. You think it's valuable. So these things, not being able to get into places, all that takes is money. Now, it's easy to say, but really, we know how to do this. I mean, you get carpenters and architects, and they can figure this stuff out. That's the easy part. I went back and looked at, this is not my field, so what recreation is, and I found there's actually a handbook. Some of you probably have it on your bookshelf called the Park and Recreation Professionals Handbook. So that's what they say recreation is, and we don't have to talk about that. So I want to talk about full participation and inclusion. And looking at the research, this guy who runs the center down in Alabama wrote an article, and he said sometimes it's just the basics. Sometimes it's just the basics why people aren't included. Doors that are hard to open, you would think that'd be easy to fix. Stairs, unpaved trails, no braille signs, the sign that's high and people in chairs can't see them. For people with intellectual disabilities, signage that's at a level that they can't read, can't participate. The feds set some goals about fitness and recreation and health. And I found some data from Healthy People 210. So look at the difference. 56% of people with disabilities had no leisure time physical activity. It's 36% for the people without disabilities. The goal is to get it down to 20 for everybody. They didn't reach the goal by 2010. And then in terms of sort of moderate activity, again, 12% of people with disabilities, 16% of the general population, so we're in bad shape, and the goal is 30%. So we've got a ways to go, and you're all part of the solution to that. They've also published some guidelines on health and disability, and again, people should be able to do stuff to strengthen their muscles, and people should avoid, that was the biggest point of this whole 58-page monograph, was people should avoid inactivity. And then they cited all sorts of reasons why inactivity just is not good for people. So listen to the news. I listen to NPR. I have about an hour and 20-minute drive to work when I go to work. And you always hear these stories about, well, if you only exercise 30 minutes a day, you walk 3 to 5 days a week, and it sounds fabulous. I mean, walking's easy, it's cheap, all you need is shoes and a road. But 14% of adults, it's not so good. There are 28 million Americans who have mobility issues. 28 million, that's a lot of people. 13 million can't walk a quarter of a mile. So you're supposed to walk 10,000 steps a day, and 13 million Americans can't walk 500 steps. So what do we do to engage that population of 13 million? It's about 10% of us. 10% of us. And the number's going up every year. One of the questions you always get, how many people are there with disabilities? The number, I looked at 4 different places, and the number seems to be between 45 and 52 million. So this report said 49.7. And they're more likely not to engage in fitness, not to get sort of basic preventative health care, not have an annual dental visit. If you want to look at the status of people with disabilities, and you want to say what, especially people with developmental disabilities or severe disabilities, significant disabilities, you want to find out what they have in common, it's rotten teeth. Because if you have a significant disability, the chances you're on Medicaid. And there's only one state in the nation where Medicaid pays for dental care, preventive dental care for adults with disabilities. One state, and I don't think it's this one, unless people are in managed care. And then people are more likely to be overweight or obese, have high blood pressure, have psychological distress. So significant issues, things that really diminish the quality of your life. And again, recreation and inclusion in recreation is part of the solution. There's some pretty dramatic results, lots of studies on what happens when people don't. What happens when people don't participate. They're more depressed. They're also less involved in other things. It's not just that they're not involved in recreation. They're less involved in other stuff in their community. And their disabilities increase in severity. They increase in severity. Now, some of you probably know all this stuff, but this was sort of news to me. So increased activity lowers depression, and then I'll talk about instrumental activities of daily living and activities of daily living. Is that something, is that a term people use a lot? Yeah. So activities of daily living, things like walking and transferring and dressing, and instrumental activities of driving, making meals, doing housework. So if you're not participating in recreation and physical activity, you have lower functioning levels on these things over time. And when you think about it, if the activities are kinds of things you can do anywhere, you can do in your community recreation center, you can get out of the place you live and go a block to a trail that goes through a park, you can go to the local community center and swim. Pretty easy prevention, at least on the surface. Pretty easy prevention. It's not medicine, but it has actually better results than a lot of medicine. Now this was an interesting story. I went to find what's the sort of seminal research article on barriers and things that help. And I'm at a university, I'm spoiled. Go online, you do a search for articles, came up with a dozen articles, printed out 11 of them because they're all online, and one, this one, wasn't online. So you look and you actually have to go to the library, and I was embarrassed. I've been there 7 years. I go to the library, I go up to the research librarian, I said, I have to find an actual physical journal and make a photocopy of it. And the guy looks at me and I said, 7 years, I've never had to do that. Everything's online. So Jim Rimmer and 5 or 6 other people wrote this article in 2004. And for every major category, and I'm not going to go over all this, there are both barriers and facilitators. Barriers, things that block access. Facilitators, things that help access. So the natural environment and the built environment, obviously, cost, both in terms of participation and making things accessible. Information, emotional and psychological barriers, There are lots of people who just don't participate, particularly true among the frail elderly. Knowledge, education, and training. And again, training is easy to address. We know how to do it. You're doing some of that here, right? And it costs money, but it doesn't cost a lot of money. Perceptions and attitudes, mostly of professionals and other people without disabilities. Policies and procedures that get in the way, and then resource availability. So here's just one example. I didn't go through all 10 of them, but so here are some barriers we see all the time for physical access. Lack of curb cuts, narrow doorways, the front desk is too high for somebody in a wheelchair, slippery floor. And then they came up with some ways to do things. Some of them are dirt cheap. Non-slip mats in a locker room cost almost nothing, cost something. Enough handicapped parking spaces, so you have to stripe the parking spaces. A zero depth entry pool is expensive. And this one blew me away. Family changing rooms so parents can help their kids with disabilities participate. Something that simple. And they surveyed thousands of recreation and leisure workers, people with disabilities, parents, to come up with all these things. The media is not always our friend. It usually shows sort of slim and fit individuals. Every once in a while, you're starting to see people with obvious disabilities in the media participating in physical activity. It's growing, but it's still abysmally small. So the big question, this is Jim's big question, how do you engage people? How do you make people recreationally engaged? I'd never heard that term before. We said there are all these barriers. So you could say, ain't it awful? Architecture gets in the way, policies and practices, discrimination, social attitudes. But everyone here is here because you think these things can be overcome. I mean, many of you do that every day. You know how to do it, all right? Here's how far we've come. And this is mostly about people with developmental disabilities and people who'd been in nursing homes. But I wanted a little history just to say it's not all bad, and we've come a very long way. So we got the courts involved. That's how we got the right to education. That's eventually how we got the ADA. They all came out of those things. The right to education actually came out of a lawsuit next door in Pennsylvania in 1972 and 3. Families and people with disabilities. Remember that movie Network, where the guy sticks his head out the window and goes, I'm mad as hell and I'm not going to take it anymore? Well, that's what families have done. They've said, it's my kid, my flesh and blood. You pay attention. Don't you dare keep them out of the school. Don't you dare keep them out of the rec center. And increasingly, people with disabilities. I'm working with a guy from New Jersey, actually, who now lives in D.C., named Ari Rimmerman. When he was in college, he has autism. When he was in college, he started this thing called the Autistic Self-Advocacy Network. He's the best advocate I've ever met, and I have clothes older than him. We've closed and phased down institutions. We learned that they don't work. New Jersey is the third most segregated state in the nation for people with disabilities. You're up there with Texas and Illinois. We've moved to this model of individual supports instead of sort of set programs. We're going to figure out what each person wants and needs. All right? And then we're going to try to do things to meet those wants and needs. And there are differences. We get involved if you work with people with developmental disabilities. Well, this is his choice. He wants this. He needs this. Wants and needs are clear. There's sort of a simple way to remember it. I want a red Porsche convertible. All right? But what I need is a reliable way to get to work. Want, need, want, need. We've got these incredible community support systems all over the country. I mean, I've been doing this stuff since 1975. And every day I see things that just amaze me. People with disabilities working, living fairly independently from formal systems in regular classrooms. I see things that depress me at the same time. But the community service system for people with disabilities since 1985, adjusted for inflation, has grown 800%. Doesn't seem like it sometimes, because there's always a demand for more and more and more. People with disabilities are living longer. All of a sudden, people go in, but it's like the Hotel California. You never can get out, never can check out. I find that as I'm getting older, my musical references don't work with certain audiences. I did a presentation in Connecticut about 2 years ago, and I said, it's just what Mick Jagger said. You can't always get what you want. Hand goes up in the back of the room. Who's Mick Jagger? I said, oh, I'm becoming my parents. But people with disabilities and families expect systems are going to provide them with support and support tailored to their needs. And everybody's needs are different. That's a double-edged sword. Some people are really disappointed by what they get. If you've ever talked to families of elementary school age kids, informed parents about what they want for their kids, it should scare you to death if you serve adults, because chances are what they want ain't what you're doing. And they want somebody to love their kid, they want the kid to have a job, someone to love them, right? Decent place to live, things to do, friends. And a lot of our programs don't do that. A lot of our programs don't do that. We learned what to do by trial and error. Sort of all the programs we started were way before we had law or research. So before we knew how to include kids in regular classrooms, we had Public Law 94-142, which became IDEA. And before we knew how to have physical access to programs and make it really work and do it economically, we had Section 504. And we've got a huge gap. If you ever have read these laws and you read the introduction, I mean, they're really noble words, powerful words. The Americans with Disabilities Act, I've seen people with disabilities of a younger generation who know about the ADA but didn't really know what it said. And when they read the introduction, they start crying because the words are incredibly powerful, but our actions and deeds don't always match those words. But all of these laws, Olmstead was a Supreme Court decision that said people have the right to live, state systems must provide environments that are community-based if that's what people want. And Olmstead was a case out of Georgia. But they're all about the rights of people, not about the rights of providers or governmental organizations. So people with disabilities are saying to all of us, we want things to change, these things about self-direction and individualized supports, and we want to be included. And don't tell me that you can't do it. It's rather refreshing. But despite all this progress, there are 35,000 people, this data is 2 years old, data for 1 year ago hasn't come out yet, remaining in large state institutions. You're just in the process of closing one in New Jersey, and I know it's causing sturm and drum, but they're there not because of people's disability. They're there because of, now I'm a union member, but they're there because of AFSCME, American Federation of State, County, Municipal Employees. They're because of rural legislators and families who have guardianship. There are 90,000 people in smaller institutions. There are only 2 states that don't have those places. And then there are 25,000 people with disabilities in nursing homes who their reviews show they don't need to be there. And any of you have ever encountered the group ADAPT, all right? They periodically chain themselves to things. But that's how they got started, for people with physical disabilities who got placed in a nursing home due to an accident and never could get out. There wasn't anything in the community for them. And they're really vocal about, not going to live there, not going to do it. Increasingly, what's happening with the elderly, my class last night was about caregiving for the elderly, and the number of nursing home beds in the country keeps on going down and down and down and down. Old people want to age in place. They don't want to go in those places. And a lot of those places filled beds when that started to happen with people with disabilities. So that's changing. So you can't find community and inclusion on your GPS. All right? Now, you're all from New Jersey, and when I get lost in New Jersey, instead of using a GPS, I call my brother-in-law, and he says, just go to exit 10 and make a left, all right? Because he identifies everything by exits. I was in Baku in Azerbaijan doing a project. They sort of work on an old Soviet model, and if you look funny, they put you in an institution. And we were out having dinner one night, and people from Azerbaijan, Azeris have a very special look. You can sort of tell if somebody's from Azerbaijan. And we're having dinner in a camel stable that was 800 years old to turn into a restaurant. And one of the people I was with said, oh, there are 2 people I know over there. They come and join us. So they sit down, they introduce themselves. The woman starts talking in English with a pretty heavy accent. The guy starts talking, and I said, wow. And I'm just listening and I'm listening. I finally said, all right, I've got to ask, where are you from? And he looks at me and he goes, exit 9. That's all he had to say. That's all he had to say. So getting people out of institutions, though, has been about real estate. We moved people from big houses to little houses. We didn't really sort of change how they lived. We went from 24-hour-a-day, 7-day-a-week services to 24-hour-a-day, 7-day-a-week services, even when people don't need that. There are lots of people who don't need as much as they're getting, and especially as technology has grown, we've learned ways to help people become more independent. In my class Monday night, I said, well, you know, some people are putting cameras in people's homes, people with disabilities' homes, or people who are elderly's homes, and then you can log on and you can see what's going on. Now, you don't put it in the bathroom, But you can see what's happening. And a couple people raise their hands, I object to that, it's against their civil liberties, this and that. Two hands go back up in the back of the room. Well, that's what my dad does with my grandma. And then talked about how easy it made it to keep grandma in her home. And what they wanted to see is, did she fall? Did she have dinner? Those kind of things, without having to get in the car and drive 45 minutes to do it every time. So you can't find community and inclusion on a GPS. One of the reasons we do inclusion is, how many people here are married for a long time? Yeah, okay, 38 years. When people are happily married, they're healthier, they're wealthier, I guess they're wiser. But imagine the negative effects, what happens when we stick you with a bunch of people you don't like, especially if we stick you to live with a bunch of people you don't like. I mean, we do that in sort of two environments in our country. We do that in college dormitories, and we know how normal those environments are, right? Yeah, and we do it in summer camps, and you can watch all those camp movies and find out what happens there. I work at a university that was the true scene for Animal House, okay? It was based on the University of Delaware. So bizarre things happen in those congregate settings, but it's temporary. But if you say to a person with a disability, you're going to move into this house with 4 other people you don't know, you may not like them, but don't worry, you only have to live there for the rest of your life. It causes some other issues. Here's a little more about how we got to where we are. It started out with a guy named Wolfensberger who had gone to Scandinavia from Syracuse University, and then he went over to Canada, a place called the Aaron Rohr Institute. And the Scandinavians had the principle called normalization. That was sort of the first region of the world where they said all people with disabilities should live in neighborhoods. They shouldn't be isolated. And then it went to inclusion. Here's how we're going to include people, things. I'll explain these things in a minute. And then self-determination, and now we talk about supports a lot. So normalization says, these large places strip people of humanity. It's horrible, and we have to stop doing it. The idea was we'll have some kind of system in the community. Inclusion was really about segregation, and all these home-like and job-like programs don't work. I send my students from one class to go see shelter workshops. They've never seen people with disabilities sitting around in an adult day health program. And they come back and they have to report on what they saw, what they observed, the interactions. There are a whole bunch of questions they have to ask out. And they always come back and say, it was interesting what we saw, but we were there on a slow day. Okay, now I've been going to those programs for 35 years, and I've never been there when it's not a slow day. And remember what I said about boredom in the beginning? You see 40-year-olds with coloring books, filling things that something's not right. Something's not right. So the challenge was, how do you get people to be members of the community, not just physically present, right? And then self-determination, and New Jersey was one of the pilot states. How do you shift power to people? How do you create, and this is America, we have a market economy more or less. How do you create a market economy so the person's the center, right? Not the provider, not the case manager, not the state, but the person. And the person can control what they want. Now, people usually say, well, but some of the people we work with can't make those kind of decisions. And yeah, they can't by themselves. But imagine, I have a sacred morning routine, all right? I get up, I pad downstairs, grind the coffee beans, pour the water in the coffee maker, sort of push the little button and it starts, turn off the alarm system, go outside, get the New York Times from the driveway, put the little plastic sleeve in a little basket for recycling, and sit down. By the time I've done all that, coffee's ready, have that first cup of coffee, and it's, all is right with the world. Right? Morning routines are incredibly important. Well, imagine if you couldn't even control those things. If you couldn't even say, and everybody, no matter what level of disability they have, has those morning routines. They may not use the words, but people who know them know what those are. And the same thing with evening routines and all those other things. So we wanted to give people control of resources and then let them decide, or let people who love them decide. For kids, it's parents. We're clear, if you're 12 years old, you do what mom and dad says sometimes. Never work with my kids, but. And then the idea of supports, it's, okay, let's break this stuff down to the smallest unit possible. Does someone need help getting out of bed in the morning? Yeah, okay. Does someone need help getting to the store? All the small individual things, and put together a program. And I can tell you from running programs, this is really hard to manage. Because what you might have, I have a friend who runs programs. Anybody work with an organization called Neighbors? They're here in New Jersey. And Everyone in her organization lives in their own place, maybe with one other person, and has the supports model for services. And she has some of the most significantly disabled people living in the community in New Jersey. And she'll tell you, it's a bear to manage, because John on Monday needs 4 hours of support to do all this stuff, on Tuesday needs 3, and on Friday may need 5. Well, how do you budget for that? How do you staff for that? Because we've had these models that have fit in sort of routine boxes. And then something else is going to happen. There's a book by a guy named Poe Bronson called The New Thing. And it was really about Silicon Valley and how you have to constantly, invent and recreate yourself. But we always have the new thing. And there's going to be something that comes next. And it always comes before we finish doing the one we're doing right. But your job is sort of to figure that out, to be aware of it. And you see things much more than I do. You're with people every day. You know what happens to people or doesn't happen. Another chart from Rimmer. But he said, here's what has to change. We've got to go from sort of these national, state, and local health programs and disability service providers, and we've got to move to where inclusive recreation is the intersection of all these things. It's got to be where things take place, because it's a cure for boredom, it's a cure for isolation. We know people do better when they're included. Lots of data on that, both for kids and adults. And recreation is such a big part of some people's lives, it could be a big part of everyone's life. And one of the challenges to change is that, and again, I've got to update these cartoons, because this is a Pogo cartoon, and how many people here remember Pogo? Oh, that's really depressing. But he originally did this, a guy named was Walt Kelly, did this for Earth Day, and he said, we've met the enemy and he is us. Right? Well, the very things we have to change, the systems that we have to turn from congregate to inclusive, from segregated to individualized, right? Well, the people running those programs are proud of them. I have a photo essay book from the state of Washington. This incredible photojournalist followed families around for a couple of years, pulled pictures together, and there were pictures in that book, right, of families literally laying brick, putting up drywall in the 1960s for classrooms attached to schools and churches so their kids with disabilities could go to school. So how do you say to them, we don't need that place anymore? How do you say to Mr. and Mrs. Jones, who work their backsides off to raise money for that house where 12 people live, and how do you say to them now, 12 people mostly don't want to live together, maybe sometimes. So change is painful and hard. It's painful and hard. Last year I had to do a presentation to a dental convention on disability and health, and I found this cartoon. And I really hate dentists, with a passion. And so I made them all sit there with their hands on the table. I said, I want to see your hands before I start talking, because you could come near me. But change is about people and behavior. It's not about laws. It's not about structures or regulations or policies. So change is really about fear of losing things. It's about fear of losing things. It's about losing your reputation. My job might get lost or change if we have to change this program. I'm good at doing this, but I might not be able to do what you're asking me to do. That's where training comes in. I'm going to lose my friends. I go to this building every day. I work with these 20 people, and that's part of my social life. If you do this distributed stuff out in the community, I'm not going to have that anymore. It's about losing connections, power, control. You have passion for what you do. We work really hard, families especially, and professionals who have built programs especially. I said the programs have grown over 800% since 1985. My generation of professionals built these programs. That's how you made your career. You're going to lose focus. The culture in my organization is going to change. Again, I'm going to lose respect. I'm not going to have input into how things work. I had the state director of developmental disability services in a state not to be mentioned said to me, you mean you're going to let people choose where they live? But she was shocked. Like, how can you let those people choose? We're going to lose the history of our organization. We're going to lose prestige. So we've also got to stop doing some things, and I work with lots of family groups around the world, and we've got to stop saying that people are going to be independent. You hear that all the time. We're going to make him independent of... And there are functional independence skills. Independence of doing certain things on task is important. Independence in dressing and feeding and toileting, those are important concepts. But the goal isn't independence, it's interdependence. Recreation is about interdependence, all right? And it's about self-governance, control the major variables in your life. You can't control nobody in here controls every variable in their life. You just don't. All right? So none of us functions independently. We're all interdependent. Interdependence builds social capital. You know, you're all part of a neighborhood or a community or a church or a recreation association or a company or an organization, all right? So talking about independent living, it scares families, first of all. And it confuses policymakers because they'll see somebody with significant disability and go, well, how can that person live independently? And of course, that's not the goal. It's to have them have control over things. And then governments and funding organizations have both an edifice complex and FAS. And FAS is not fetal alcohol syndrome, it's facility acquisition syndrome. So when we see people who are different, we think building. I had a group of families come to me about a year ago, and we were living in Delaware at the time, and they had built this brand new gorgeous health club 5 minutes from our house. And after about 3 months, another health club a mile away went bankrupt because they just couldn't compete. Their facility wasn't as nice. This group of families had started to raise money to buy it and say, we'll have a health club just for people with disabilities. Will you help us? No. But let's talk about why that's not a good idea. I mean, if you want to keep people isolated, make them go to different places. Make them go to different places. So I have some golden rules of working with families. I have scars for every one of these things. You know, we've got to tell the truth. We've got to say things are changing. Sorry, the world's a changing place. But people with disabilities are the ones who have their rights at stake, and sometimes their families are not the best judge of things. Sometimes. Sometimes too often, right? Especially you hear from people with physical disabilities. When we work with people with intellectual disabilities, you can't help but talk about families because their families are involved their whole lives. Talk to people with physical disabilities, and it's like, You know, mom and dad were the ones who said, I can't, and I can. We've got some interesting things about people. This is specific to developmental disabilities, but I think it's true for all disabilities. Over half who get publicly funded services, it's true in New Jersey, live with their family. And in 5 states, it's 70% or more, and the number's only going up. So our model used to be, you become an adult, and at some point you live in a group home, you live in a supported apartment, you get to move out. That model is no longer operant. And the waiting lists are about 850,000, again, people across the United States waiting for a place to live. It's not going to happen. The supply of affordable housing in the US goes down every year slightly. Lots of new stuff. Incredible programs like Habitat for Humanity, and there are local programs like that do stuff, and developers do stuff. But more stuff comes offline than goes online. And if you had to ask for people with significant disabilities, what's their single most common characteristic as an adult? They're poor. All right? Our public policy keeps people with disabilities poor. If you're on SSI, Supplemental Security Income, or SSDI, you don't make enough to afford an apartment, a one-bedroom apartment in any census tract in the United States. Right? So we don't know enough, but recreation has to be part of the solution. And people, again, are doing very creative things all over the place. You're doing some of them in New Jersey. Studied 2 years ago about people with disabilities living with their families, and this slide's a little out of order. Actually said they're better. They're less lonely, they're less afraid, they're happier, they like it. So it's not all bad, it's just different. One of the other things we know is that quality services don't necessarily equal a quality of life. I used to work in Ohio, and we ran services, and we were so proud that in our group homes, every year the nurses would come from the health department and we'd have no deficiencies. Absolutely none. And then we figured out the reason we had no deficiencies is we were keeping people from doing anything. So we really had this soul searching of, how many hits are we willing to take? We finally devised a strategy, and I don't recommend this for anyone here who's in the residential services business, but we would do 3 things. We would poke holes in screens. We would make sure, at least in one of the bathrooms, there wasn't a roll of toilet paper in the toilet paper holder, and someplace non-essential, we'd have the light bulb burned out. So they would come and they would cite those 3 things. They took about 5 minutes to fix, and then they would leave us alone, and we could try innovative stuff. But I don't recommend that. And finally, we've got some policy challenges. People with disabilities are getting older, all right? We've got the first generation in the US and in Canada and in much of Western Europe of people with significant disabilities living to old age. I was in Shreveport, Louisiana. Anybody here ever been to Shreveport? Not a place you should visit voluntarily. And I'm sitting at the airport flying out, and you read the Houston paper there because there's no local paper. And I'm reading this story, and you turn to the last page, and there's a story about a guy. And it said, you know, he was active in his church group, and he mentored youth, and he participated in the bowling league, and he was a member of the Lions Club and all this. And he worked at Piggly Wiggly until he retired for 35 years. And then the last sentence was he had Down syndrome. Now, when I started doing this stuff, people with Down syndrome died in their 20s, and they're now living until their 60s and 70s. So the world is changing. We're not sure what to do about all this. We know that as you get older, if you don't have a disability, you're more likely to acquire one. And every 5-year cohort, starting at 65, the incidence of acquired disability, hearing loss, vision loss, mobility impairment goes up. It goes up. We know that families are increasingly poor raising people with disabilities. Poverty in the U.S. has increased over the last decade, not going down. And caregiving costs a lot. The average cost of care for a person with significant disabilities is more than the median income in New Jersey. So families can't do it all, yet they are doing it all in many cases. And they're not only spending things out of pocket. The average family raising a child with a significant disability is spending about $16,000 a year out of pocket, but they're working less, mostly women. Right? Which means that for women, and they're educated, they've got a 1 in 4 chance of being divorced, which means they're much more likely to be poor when they're old, because less earnings and Social Security, less savings. We've got huge waiting lists. You know, special education's an entitlement, adult services aren't. I don't know the length of the waiting list here in New Jersey. They're always suspect because things change. Everything can be fine. Somebody's living with an 80-year-old parent, all of a sudden somebody dies, and all of a sudden you've got a crisis for services. We know that they'll grow. The economy is not going to grow fast enough in any state to serve people who need it when they become adults. And that means stress on families will increase, not decrease. And we still don't have a conceptual model for how do you deal with adults living with families, all right? Kids, we understand. You're a 12-year-old, again, do what I say. You're a 25-year-old and you're a recreation worker, and Mr. Jones brings his son, who's 25, right, to a recreation event and says to his son, you're a stupid jerk, you're lazy, no good, you know, go over there and do something before I slam you upside the head. Now, if that was a group home worker or a day program worker, you'd know what to do. But it's dad. And you don't see any signs of physical abuse. What do you do? How do you say there are rights of the adult with disabilities, there are rights of the family? How do you sort of optimize both? You can't maximize both, but you can optimize both. Lots of divorce and single parenting, though I did a study trying to look at divorce among parents of people with disabilities, and the studies contradict each other, but by and large it seems there's not a difference. There's not a difference. That being said, divorce rates are still high. Our direct support workforce is inadequate. The Department of Labor, since the Civil War, has been keeping track of the size of our workforce and where people are. And most people who get paid to do caregiving are between 18 and 45, and they're mostly women. People 18 to 45, that cohort, as a percentage of the population, is the lowest it's been since 1866. All right? People are having fewer kids. We had the baby boom, and then we had the echo boom, and now we're having people having fewer kids. We're sort of at the replacement rate. We sold community services for people with disabilities to state legislatures saying it's cheaper than the state institution, right? And it's cheaper than nursing home. Well, it's cheaper because we paid people less. About 70% of the cost difference is we paid people less, and year after year after year, that's sort of compounded. So we've got this workforce that isn't big enough, doesn't have enough training, and doesn't get paid enough. And as a result, turnover is high, and the more significant your disability, the more you need to have long-term relationships with people. And so there's lots of talk about immigration. In Congress these days, you can't help but reading about it, hearing news clips about it, and immigration is part of the solution. In Delaware, where I work, most of the people doing direct care from West Africa. And they come, and they go to community college, part-time, and they work in programs, and they get a degree. They come to the university, they get their bachelor's degree, and then they're off doing something else. So they serve us for a while, and they get to live out their version of the American dream, but they don't stay committed. We've got huge health disparities. One of the things, if you want to start a fight with a person with a disability, just talk about the medical model. And we're going to go back to the medical model of care, and you'll have a fight on your hands. Well, we threw out the docs and the nurses and the dentists, but we need them. Good health takes work. We need what they know how to do differently than they did in the 60s and 70s and 80s. All right? Our reimbursement models, again, most adults with significant disabilities have Medicaid. Medicaid pays crap. Can I say that here? Yeah. And it frequently takes longer to work with people with disabilities than others. So you have people paying low rates, and at the same time you have people who take longer. There was a case last year in the District of Columbia where a child, keep on holding his mouth, holding his mouth, holding his mouth, family was on Medicaid, and they couldn't get a dentist to see him. And tooth abscessed, it became a systemic infection, and he died because of low reimbursement rates. So it's not just a fiscal issue. The population of people with disabilities is growing, and it's going to increase as we live longer. You talk to people who deal with veterans with disabilities, and there are people who a generation ago wouldn't have survived their injuries and now are surviving their injuries because of battlefield medicine. And we've got to figure out, how do we help those people have decent lives? We can't forget them after what they did for us, right? But look at those numbers. They skyrocket. I mean, more than double, and more than double. So predictions for the future, finally. How do we do genuine community inclusion and participation, acceptance for all, without qualifying it about, well, we can't do it for them. We can do it for these people. We can't do it for them. And I've been studying this for years, and I've figured out that the ideal thing is a dimmer switch. The dimmer switch allows you to adjust the light up and down, right, infinitely. I use this when I explain things to judges in court cases, and that's what individualized supports is. You just make it a little brighter, a little looser, a little lower. You can do it quickly, all right? We know how to do that. Some people call that person-centered planning. Dr. King said, I have a dream. He didn't say I have an annual plan, quarterly goals, and all my records neatly filed. To keep it egalitarian, Lou Holtz, a longtime Notre Dame coach, said, people need something to do, someone to love, something to believe in, and something to hope for. And again, recreation is such a big part of that. And then Copernicus said, who's at the center of the universe? And in our human service, in our recreation universe, it's the people we support. That's where the power is. So we believe in the power of community. We did a survey of very progressive provider organizations around the country, and this is what they said. This is what they said. At the end of the day, here's what matters. People you love who love you, following your dreams and giving back to the world. And they serve a wide variety of people with disabilities. So I'm a college professor. Every college professor is fairly convinced they have 10 IQ points on Einstein. Certainly the ones I work with are. But they said, the problems we face can't be solved at the same level of thinking, or insanity is doing the same thing over and over again. We can't do what we've always done. We can't. We have to have a couple of very difficult conversations, and I think we can do that. And one is about quality. I can get in the car, go 15 minutes from here, and find things that you go, wow, that's really amazing. They're doing such great stuff. I can go 15 minutes in the other direction, and I could say, oh God, this is no longer 1970. And the difference is leadership. It's not money. It's not the workforce. All right? It's leadership. It's values. It's attitudes. So everyone here can help fix this. Sort of my recommendation is always, you need a plan to get rid of the old stuff. 3, 5, 10 years, I don't know how long, but you need a plan. Can't do it without a plan, some measurable goals and objectives. You have to stop fixing up the places that keep people segregated from the community. We just can't do it anymore. And this is where the 5% rule comes in. We've got to train people more. I mean, there's a survey that comes out from one of the big consulting firms every other year, and it looks at the Fortune 1000 companies that do the best and shows a direct correlation between companies that do the best and how much they spend on human resource development and training. There's a direct line. So we know how to do community inclusion for everybody. It's being done sporadically in different places. It's hard work, but so is most important work. And it's better for us, it's better for our country, and it's certainly better for people with disabilities. Thank you.
To learn more about the New Jersey Commission on Recreation for Individuals with Disabilities and the group's annual conference, visit njcrid.org. That's njcrid.org.